So here we're going to do a walkthrough of vestibular and auditory systems in neuroanatomy. Let's start with the ear, its anatomy and physiology. Now you can explore these topics in more detail on the tutorial on the site. The different membranes, lymphatic fluid, cochlear tonotopy, and then vestibular directionality. The basic anatomy of the ear is there's an external ear canal, a middle ear canal, and then an inner ear canal. The middle ear canal has from lateral to medial the malleus, the incus, and the stapes. We can remember with the acronym MIS. And then the inner ear canal has the semicircular canals and then the cochlea. So looking at this in more detail, these are our orientational planes here. External ear canal ending in the tympanic membrane, then the middle ear canal with its eustachian tube and its malleus, incus, and stapes. And then the inner ear canal here with the semicircular canals and the cochlea. Now let's add in the ducts. So the cochlear duct here, and then we add in the vestibular duct connecting with the vestibule here, and then we add in the tympanic duct here. And then we add in the otolith organs of the vestibule here, the utricle and saccule, and then the different semicircular canals, horizontal, posterior, and anterior. And we'll explore these in more detail in the next tutorial. So when a sound wave comes in, it strikes the tympanic membrane. It's transmitted along the malleus, incus, and stapes to the oval window. It's transmitted along the vestibular duct, and then it crosses the apex to the tympanic duct, and then is transmitted back here to the round window. The semicircular canals, and we also learn about benign paroxysmal positional vertigo, and the reason for this is that in BPPV there's calcium carbonate crystals from the utricle and they fall into one of the semicircular canals. And this tutorial will allow us to localize which semicircular canal is being affected in BPPV, which is a really important common clinical disorder. So these are just some basic planes to help us out in our orientation. Now, what's important to know is that when we're talking about this here, we're talking from the observer's perspective. So what the observer sees of the patient's eye. So when the anterior semicircular canals are activated, the eye moves upward. When the posterior semicircular canals are activated, the eye moves downward, whereas when it comes to the horizontal semicircular canals, when the right one is affected, the eye moves clockwise, and then when the left one is affected, the eye moves counterclockwise. So if the right posterior canal is activated, so on the right side here, the slow phase is going to be of the nystagmus, of the eye movement itself. The eye abnormality is going to be downward, because posterior, and clockwise, because it's on the right. The fast phase of the nystagmus, which is actually how it's named, is going to be in the opposite direction. It's going to be upward with counterclockwise rotation. So the activation itself, the slow phase, is consistent with what we're describing here, whereas the naming, which comes from the fast twitch of the nystagmus, is going to be in the opposite direction. So that's a really quick run through of the vestibular and auditory systems. There are more tutorials on the site that go into neuroanatomical circuitry of vestibular and auditory information, but just wanted to quickly walk through some core anatomy there.